Recording in progress.
And good on my end, Ashley.
And we are good on my end as well.
Excellent. Just one moment, please, Cassie.
I see a couple more people come in the waiting room. Did you see that?
Yeah, thank you. We'll definitely get them as they come in.
Great. All right. I see Ryan Harris at Como saying he still needs permission to record.
Yep, as they come in, we will definitely get them.
Great, thank you. Okay, so we'll go ahead and get started. Everyone should have permission to record, but if you don't, please send it in the chat. Good morning, this is Cassie Sauer. I'm the CEO of the Washington State Hospital Association, and really pleased that you've joined us today for our media briefing, which we're currently doing about every other week. We have a great guest today. We have Dr. Seth Cohen, who is the Medical Director for Infection Prevention at University of Washington Medical Center. We have Renee Rosillier-Bomers, who is the Chief Quality Officer at Swedish, and you've met Renee before. She is the mastermind behind the big Swedish vaccine sites, which now includes the Amazon site, but formerly had both Seattle U and Lumen Field, which have been a total treat to be part of. And Nicole Eddins, who is a pharmacist, and Renee is a nurse. Nicole Eddins is a pharmacist, and she's the Senior Director for Ancillary Services at Mason Health in Shelton. So thank you three for joining us very much. So I'll start with where we are with COVID right now, which is that we are better, actually pretty significantly better than we were last week. This morning, we're showing 865 hospitalizations. That compares to 968 last week, which is a 12% decline. And also a pretty significant change from what the average was a month ago, which was 1,087 was the average over the last month. So we're really pleased to be going down. In addition, we're seeing a decline of people on ventilators. We now have 120 patients on ventilators, which is a 29% decline in the last week. I want to remind folks that that decline is both from people getting better and leaving, and also from people dying. We continue to have 10 to 15 people die in the hospital across the state every day from COVID. This morning, I was out walking my dog and feeling frustrated by this number of 10 to 15 people dying, and feeling like we're sort of accepting that as a society in a way that I really think is bad. And I decided to look up how many people died in the duck boat accident. And there were 5 students that were killed in the duck boat accident, 70 people injured. That's what I could find in the news reporting anyway. And that caused just massive change and a shutdown of the duck boats, and huge reconsideration of transportation systems. And we have 2 to 3 times that many people dying every day. And so really encourage people to continue to do the things that keep them and their community safe, getting vaccinated, wearing their masks, wearing a good mask. I think Dr. Jeff Duchin from the Seattle Health Department makes a very compelling case about it's time for a better mask, with surgical masks and N95s and KN95s being pretty widely available, that moving away from the cloth masks to the more effective masks is really worthwhile, and not really keeping your distance from folks who aren't vaccinated. We also know, we're watching with concern, I think Dr. Cohen may speak about this as well, our colleagues in the Northeast and the Midwest seeing a pretty significant growth in COVID cases. I've heard from my counterparts in Missouri, Connecticut, New Jersey over the last week, especially over the weekend, feeling like, oh my goodness, this is getting bad again. So that really got my attention, to be hearing that from other parts of the country. And so we don't want to be in that position. We do not want to be in one of those states that's in that, is it getting bad again? But their numbers have gone up pretty significantly in the last few weeks. Vaccines are widely available. It can take a little bit of work to get a kid vaccine. I did get my 10-year-old son his first shot. I woke up at 3 in the morning, just kind of naturally woke up and was like, maybe there's some slots have been added. So I actually did find a slot at 3 in the morning, which might sound a little crazy, but we went to Walgreens and had a lovely time, and I'm very happy to get that. I think I saw this weekend The Seattle Public Schools, which I've got kids in, was sharing that they had more vaccine available than they had anticipated, and they had some spaces available for walk-ins when in their prior week's clinics they hadn't. So seems like maybe the first week was pretty tight, but hopefully next week and the week after there'll be a lot more space for the 5 to 11s, and really encourage people to get those kids vaccinated, especially as the holidays come along, that they can have the best chance possible of not spreading this disease to anyone in their family. We're also very interested in encouraging people who are eligible for boosters to get booster shots to get them. We do see some signs of waning immunity, as happens with many vaccines. And so really encourage folks to be seeking out their booster shots. Originally, as you know, only the Pfizer folks were eligible for boosters. I, for example, have Moderna. There was no booster available. Now there is boosters available for anyone who got Pfizer, Moderna, or J&J. All 3 have boosters available. So very, very much encourage people to seek those out. I also want to share we do have the updated data about hospital staff vaccinations. So about 94% of hospital staff statewide are fully vaccinated, or got fully vaccinated. We lost about 2% of staff, and the remaining staff have sought and received an exemption and have been accommodated or are in process of getting vaccinated right now. So that's better than we thought. It's higher in urban areas than in rural areas. So it remains, in some rural communities, this remains an issue of vaccinations. We see that services are still constrained in some communities from the mandate and from a number of other issues, including, just like, is there enough childcare? Are people burned out? The staffing agencies, people who wanted to avoid the mandate leaving for other states. The federal vaccine mandate goes into effect January the 4th. That will make Washington be in line with all the other states in the country. We were concerned about that. Would people who didn't want to get vaccinated just leave Washington and go elsewhere? I think they have, but that time window is not very long before, in order to work in healthcare, you have to be vaccinated. And so that gets to my final point, which is that hospitals are very concerned about staffing and doing a lot of work to retain staff. They're offering incentive bonuses and retention bonuses and posting as many jobs as they possibly can, heavy recruitment, working with staffing agencies, really trying to retain the staff they have and get more staff. We're very pleased to be starting conversations with the state legislature and the governor's office about significant investments in workforce, especially in the healthcare area. And I think there's some real promising possibilities here for expanding training slots. We continue in our state to turn away hundreds or maybe thousands of qualified applicants to healthcare programs for lack of space. So we're excited that this may be a silver lining of COVID is increased attention from the state on workforce training in the healthcare field. So those are all of my opening comments. And Dr. Cohen, I'd love to turn over to you for what you're seeing and especially what you're thinking when you look at the Northeastern states.
Sure. Hi, good morning, everyone. I'm Seth Cohen. I'm an infectious disease doc and medical director of infection prevention at UW Medical Center. Thanks so much for having me. A lot of people have been asking about celebrating the holidays safely, and I think this is a very, very timely topic. So I'm happy to cover that, as well as what we're seeing in other parts of the country. I think as Cassie alluded to, we're seeing mixed signals around trends and case counts in many parts of the country. Thankfully here in Washington and in Seattle, things are going down slowly and may have plateaued, but COVID is unpredictable. And as we head indoors for the winter, we know that COVID thrives in indoor environments, which is really part of what we're seeing in the Northeast. I do think that there are many reasons for optimism this holiday season. And thanks to vaccines, there are several things that are now on the table that I think would have felt much riskier last year. And I'll just reemphasize that the single best way to ensure that your holidays are safe is to spend time around people who are vaccinated. And this includes children who are eligible, as Cassie mentioned, which is just so exciting to be able to offer this season. And even though we expect to see less flu than usual this year, I would include flu vaccination as another really important layer of protection for you and your family. And I think as I was reflecting on this, the things that make holidays so enjoyable for many of us are also what can make them so high risk, right? I mean, we're excited to see elderly parents and grandparents, and perhaps seeing a new niece or nephew or grandchild. But it's really important to remember that many of these folks remain at risk for complications due to COVID. And so sitting around the table, talking and laughing and singing or hugging, these are activities as a parent. It makes me very nostalgic for years past. But as an ID doctor, it makes me very nervous for indoor transmission events that can be spread very efficiently through aerosols. And so because vaccines decrease the ability to acquire and transmit the virus, they will make these celebrations significantly safer, particularly for kids compared to last year. And so I think it's really important to remember that this virus is not going away anytime soon. And I think for our collective mental health, the conversations that we should be having with loved ones, particularly around the holidays, are not about when will this be over or what can we do when things get back to normal. I really think the important conversations that we should be having are, how can we live with this safely? What can we all do to protect the vulnerable people in our communities? And so when I think about how to make things safe for me and my family, there's still several higher risk activities that I'm postponing for the time being. The major one is I'm still avoiding spending time in crowded places, particularly indoors. And when my patients ask me about holiday plans, I usually break things down into, what's the travel risk and what's the destination related risk. So I think with regards to travel, most airlines are doing a really terrific job making flights relatively safe. I think the highest risk times are lining up at the security gate or at the gate leading up to the airplane, trying to navigate crowds at the airport. And this is when it's really crucial to be wearing a high quality mask at all times. As we talked about before, really making sure that this is a well-fitted, multi-layer mask. Want to be using hand sanitizer liberally, which of course will help protect you from other respiratory viruses that are in circulation, not just COVID. And then when I think about your destination, I think it's great that families and friends will hopefully feel more comfortable getting together this year. I do think the one lingering limitation is trying to keep gatherings on the smaller side. So at our house, for instance, I'm going to be having my parents as well as some relatives and friends over. All attendees are going to be vaccinated, but there will still be a few people present with an underlying medical condition or folks that we may not see regularly. And so because of this, we're taking some extra protections, asking people to actually quarantine as best they can for a week leading up to this, just meaning, just kind of dropping things out of their social schedule and just trying to focus on, limiting exposures before they come over. And then we'll double check that no one has symptoms or has a known high risk exposure before coming into the house. And so overall, I'm really looking forward to celebrating the holidays with people that are not only important to me, but also people who I feel I have a responsibility to keep them safe. So with that, I wish all of you a happy holiday season and happy to take questions now or afterwards.
Let's go through all of our panelists and then we'll come back to questions. Thank you, Dr. Cohen. I got some good tips there for my holiday season as well. Renee, how's it going at the Amazon Swedish site?
Hi there, I'm Renee Roslier-Bomers. I'm the Chief Quality Officer at Swedish Medical Center, and it's going well. Very excited to be back vaccinating now kiddos at the Amazon Center in partnership with the City of Seattle and Virginia Mason. We opened up Amazon on the 23rd, 24th of October. And in our partnership with Virginia Mason, we're alternating weeks. VM kicked off pediatric doses last week, and what Casey described, it filled up within 10-15 minutes of posting. We were able to fill all the sites. We are doing community, working with small community partner organizations for vulnerable kids who would not otherwise have easy access in order to ensure that we've got good diversity, equity, and inclusion. And otherwise have been working very diligently within those partnerships to continue scheduling. Swedish Medical Center was able to offer kiddo vaccines this past weekend. We hosted 300 shots. So the first weekend we were able to vaccinate 2,080, And this past weekend, 300. And the biggest question is, well, why the drop? And it's not because of a lack of desire to get shots, very similar to what I would say was the Lumen experience. We have a need for more pediatric dosing. So we're working very closely with Public Health King County and the state to ensure that we're getting the volume of doses that we need. So we're putting in our requests every single week and hope to be able to increase it to better thresholds so that we can get more children vaccinated. I've got 4 children under the ages of 11 who were vaccinated last week. And I can tell you, when I'm thinking of my holiday celebrations and to what Seth described momentarily before, vaccination is quite critical. And I know from the school's perspective, many of the districts have been working diligently to ensure that they can see those volumes increase in the vaccination rates so that we can reduce exposures and spread of COVID within those school settings. Likewise, Swedish Mobile Clinic will be partnering with other organizations, particularly vulnerable populations, to provide pediatric dosing. One thing I do want to call out, though, is we do have a focus on our children 5 up to 12, but we still are encouraging booster vaccines. And so Amazon and our mobile clinics have still been running both Pfizer and Moderna boosters for those who meet the indications. And likewise, still getting some dose 1s and dose 2s for those who have been hesitant or who are just now at a state where they're interested in getting vaccinations. So we encourage adults and those over 12 to also entertain Amazon as a site for either your booster or dose 1, dose 2. We do have appointments. We're averaging about 1,500 doses every single day, though we have capacity for more. And we do take in walk-ins. And so I know it's been nice to be able to get some folks who've had challenges getting those appointments through other sources. Just come on down. For adults, you're able to walk in on Amazon. We're offering appointments on the weekends and Saturdays and Sundays from 9:30 to 3:30, and you can visit the city website in order to do so. So thank you, Cassie.
Thank you. Thanks, Renee. Can you talk through when you say those for whom the booster is encouraged, maybe both you and Dr. Cohen could talk about this. Who do you put in that category? And I've heard a number of people say, think broadly about whether or not you fit.
Absolutely. Seth, did you want to?
Oh, sure. I'm happy to. So, we really need to prioritize people who are immunocompromised for boosters, as well as those over the age of 65 and people in long-term care facilities. But I think the way that things are moving, I suspect there will be a much broader indication for boosters coming in the next few weeks or months. And right now, they are approved for people who have any underlying medical condition, even if you're under the age of 65, and those are outlined by the CDC. And we are seeing evidence of waning immunity. And so I think it is, even though boosters are sort of offered as a nice silver lining that we have access to them, I would strongly encourage anybody who is eligible to take advantage of that to help blunt any COVID surge that may occur this winter.
And even though you said we need to prioritize folks who are over 65 and in long-term care settings, my understanding is there's actually plenty of supply. Is that correct, Renee? That you could probably serve if
the supply.
People shouldn't hold back waiting for allowing someone else to go in line because there's plenty of room in the line, I think is the case.
Yes. No.
Okay.
Agreed. And that would also be inclusive of folks who are in high-risk areas, our first responders, in addition to our clinicians, healthcare workers. There is plenty of supply for the adults. We are getting good volumes of our Moderna and Pfizer. I would say the challenge we have right now are pediatric doses that will grow incrementally. But however, we've also heard the distribution, especially with school districts and others, and CVS and Walgreens, in addition to Amazon, it's widespread. So it might take you some time to get an appointment for your kids, but continue doing so, especially around the holidays.
Great, thank you. And just to remind folks, there is a federal pharmacy program in addition to a federal, the distribution, the state-based distribution to hospitals and other health providers. Thank you. All right, Nicole, let's hear what's happening in Shelton.
Good morning, Cassie. Hello, everyone. My name is Nicole Eddins. I'm the Senior Director of Ancillary Services here at Mason Health in Shelton, Washington. Even though the state numbers have gone down a little bit, Mason County is still seeing a very high rate of COVID-19. We're sitting at still a little over 500 per 100,000, which has caused about double of our occupancy rate right now. Before I get into the vaccines, I just wanted to kind of provide everyone a kind of an idea of what's going on. Is our staff, they're stretched incredibly thin. They're working on their days off. They're working 16 to 18-hour shifts. And in the words of one of our ICU nurses, she shared with me on Friday, they're seeing sicker patients in the last 3 months than she's seen in the last 10 years. It's times like these that you dig deep to find resilience, focus on what you have control over, of course, and not over what you don't. And just like Cassie mentioned in the beginning, we're of course recruiting, providing sign-on bonuses, contracting, but I think even now is a bigger focus of our efforts are more into retention, taking care of our hardworking staff. I think our best recruitment tool is word of mouth. And when our staff feel valued, appreciated, cared for, and that message attracts other candidates. For example, we're ensuring that our staff have very easy access to a COVID vaccine, whether it be their first, second, or even third dose. And that message then is sending to them, we care about your safety. And the result it provides is, a healthier workforce, obviously, and then to take care of our community in return. Our clinical leaders are huddling daily to ensure we're helping each other out. When one department is overwhelmed, other leaders are providing help where they can spare. Keep in mind, we're a 25-bed critical access hospital, so we have a very small pool of people to pull from. But this has honestly kept us in really good shape with all things considering, and it's an amazing way to build that esprit de corps that fuels the tank during tough times and really creates powerful, trusting work relationships, and that's really what's getting us through this. In terms of the vaccines, the happier side of it, we have began providing pediatric vaccines to the 5 to 11-year-olds last week. On top of providing it in our clinic, we are also partnering with our local schools to put together a very large-scale pop-up event to kind of get more bang for our buck, so to speak. And with the very high demand for boosters right now, which is great, keeping our vaccine clinic very busy. There's fairly open eligibility to it, which I'm happy about. But with the continued hospital surges, along with lower staffing levels, it's definitely saturated our resources a bit, but we continue to do everything we can to provide the vaccine because we know that is our way out of this. And, for those of us who kind of say, when will it end? When will it end? I'm a big fan of Disney. So I just say, just like Dory, just keep swimming.
Thanks, Nicole. I like that. So I want to go back to the comment about who qualifies for a booster. I just looked it up actually, and it's a lot of, I think sometimes people hear underlying medical conditions and they think something very, very serious qualifies. So I want to read through them. Cancer, chronic kidney disease, chronic liver disease, chronic lung diseases, and that's a long list, including things like asthma, dementia or other neurological conditions, diabetes, type 1 or type 2, Down syndrome, heart conditions, HIV, any kind of immunocompromised state or a weakened immune system, mental health conditions, overweight or obesity, pregnancy, sickle cell disease, smoking, current or former, solid organ or blood stem cell transplant, stroke, substance use disorders, tuberculosis. I'll put this link in the chat. This is from the CDC. So I think we want to really let people know that the eligibility for boosters may be wider than what you have heard if you've heard underlying medical conditions and thought it was things like organ transplant or cancer that, probably especially after all eating our feelings through COVID, most of America may be covered by the overweight or obesity category. So this says, are you encouraging people who aren't covered by the current guidelines to go in and get boosters? I don't think that's what we're saying today, but I think we're encouraging people to look at the guidelines and recognize that most people will qualify either as or many, maybe not most. I don't know, that's probably a majority of Americans. I'm sort of doing the math in my head. You think about, especially if you think about overweight and asthma and diabetes and mental health, substance abuse, or smoking. That covers a whole lot of our population, I think. Dr. Cohen, would you hazard the same guess?
I agree. Just to that question, at our vaccine clinics, we are still, sticking very closely to the CDC criteria. If that criteria were to broaden, we would also, change our recommendations. But for now, we are very closely aligned to those that guidance.
And I would also offer at the Amazon clinic, we had a fair number of walk-ins with similar questions. Not clear if they qualified with their diabetes history specifically. So I think it's good to promote folks looking at those CDC guidelines carefully, because what folks might envision as chronic conditions or serious medical conditions might actually be inclusive of some of the diagnoses that they currently have.
Another question is, actually, Brian, I'm gonna tell you there's somebody in the waiting room. I don't know if you saw that. Do we expect more states like the current 4 on the list to essentially toss out the federal guidelines and encourage boosters for all adults? I actually didn't know any states I didn't realize states had done that. Dr. Cohen, are you tuned into that?
I have heard that there are several states doing this. I'm not aware. I don't have any special insider knowledge about Washington State, but I have not heard any move in that direction. And we try to stay very closely aligned with the states around us as well for equity reasons.
And then another question, at what point do we anticipate all Americans to be eligible for a booster? All right, this is everyone's going to be guessing here, but it sure seems like if, when I look at what's happening in the northeastern states, and it looks like immunity may be waning, my guess is it's not too long.
I think, obviously a question for the FDA and the CDC to tackle, but just to make the point that boosters are great. They, I think they help a lot of people who, may be vulnerable, but the biggest difference that we can make is giving first doses rather than third doses. And that's really what's going to change the pandemic, particularly in our region. Thank
you, Dr. Cohen. That's a great point, that the folks who have 0 vaccine are the most at risk. Certainly, we do see some breakthrough infections, but for the vast majority of those folks, they are a little bit sick or maybe medium sick, but not hospital sick, and certainly not dying sick. Dr. Cohen, or anybody want to comment on that? The breakthrough infections, what you're seeing? We do see, because we have a high percentage of people who are vaccinated, that's, we do see breakthrough infections because we have high rates of community incidence. But what we're seeing in the hospital, even though cases have gone down, our hospital census is really plateaued. And it is almost all people who are unvaccinated, who are really quite sick, fighting for their lives in the hospital. And this, in many cases, could have been largely preventable through vaccines. Anybody else want to comment on what you're seeing in breakthrough infections?
No, agreed. At Swedish, the majority of our cases have been unvaccinated patients, and particularly those in the ICU, prone and really struggling, are the ones that are unvaccinated. We too, likewise, have had some breakthrough cases, but those folks have tended to not require the intensity of critical care resources needed.
I think to Renee's point, once someone is in that space of being sick enough to be prone on a ventilator, their chance of survival is quite diminished. It's a very tragic point in the disease. A question about, is there an updated number for how many boosters have been given in Washington? I do not know that, but I am confident the Department of Health does. Anybody know that number off the top of your head? Okay, they track the number of boosters, so they're really responsible for the distribution of the vaccine. Has the rate of people getting boosters been pretty steady since they became available, or has there been some slowing? So part of this is maybe the timing of the boosters. Like the Pfizer folks could get it, and then there was nothing for Moderna and J&J. Now there is something for Moderna and J&J. So I'm curious if you all saw a Pfizer up and then now a Moderna J&J. Like what does the path look like? Renee, you want to take that one?
Well, at Amazon, we just race it. It's almost like a race. We watch the Moderna and the Pfizer, and we're actually staying fairly consistent. So we're about half and half, pretty steadily. Of course, we had a huge surge of Pfizer initially, and then the second week was a surge of, or the 2 weeks into the clinic, we saw more Moderna because there just was, they got approved later. But right now, this past weekend, when I was at Amazon, we were about half and half split between boosters for Moderna and Pfizer. So the uptake has been pretty even. I know in the hospital settings, we've been offering vaccines to our caregivers, and there was definitely a surge of folks. But what we've noticed this time around is that it's easy to get your boosters anywhere. You can get it through pharmacies and other resources. So the demand for on-site vaccination is waning a bit because folks just have more accessibility, which is encouraging.
Nicole, how about you? What are you seeing as far as the booster demand? Has it been slowing or has it continued steady?
Oh, we're definitely seeing a surge, which is a great thing to have. You know, our goal is to make sure we have openings at any given point. And I know our vaccine clinic, I think, has openings on a month from now, which is you know, to me, a little farther out than I'd like to be. So that's where we start looking into pop-up offsite events. And, you know, we partner with our senior center, we partner with kind of our local businesses and figure out where is the need for this and where can we bring it. So that way we provide it to as many people as possible. But it's kind of a mixture of Pfizer and Moderna. And I think once all three boosters came out, and that's when we really saw the surge for requests. So
great. Do we expect, I'm sorry. Do we expect to see more breakthroughs in those people who can't have booster shots now? Dr. Cohen, do you think you'll see more breakthrough infections among, or they're really targeted at those who are most likely to get sick? So
I think we probably will for several reasons, as you mentioned. People may also have underlying medical conditions that may predispose them to developing, COVID. I think there is some waning of, the boosters, but just keep in mind that, these vaccines are really designed to prevent against really severe endpoints, hospitalization and death. And so those are things that wane much more slowly. And many people who still had, full doses of mRNA vaccines, earlier this year, probably still have pretty good protection, but we'd really love to make sure that they are boosted, not just for this winter, but for the upcoming year for really a long-lasting, durable immune effect.
Thank you. And are the boosters on the same timeline as the vaccines, that they're in full effect 2 weeks after administration?
Yes, exactly.
Okay, great. Are the majority of hospitals in the state not allowing unvaccinated care staff to work on the front lines, or does it depend on their staffing levels? There is a wide variety of approaches to this across the state. Some hospitals are not allowing unvaccinated caregivers to work at all. Some have moved unvaccinated caregivers to non-patient facing roles, telemedicine being a particular one, might be, chart review, quality work, that it's in kind of in the back office. And some are allowing staff with sufficient PPE and potentially regular testing to continue to work. And so I'd love for each of you to address how your organization's handling the staff who received an exemption, whether and how you're accommodating them. Anybody wants to go first?
I'll go first. We have over 92% of our staff have been fully vaccinated. And for the rest, it's a kind of a combination of accommodations or a leave of absence. For those with approved exemptions, we are testing them weekly. And there are some circumstances when they are higher risk, we are requiring N95s when they're at work.
So Swedish, similarly, the majority of our staff are vaccinated. Those who do have a medical or religious exemption that were approved, depending on their care areas, if they're already in office work or non-clinical forward-facing or working from home or doing telemedicine, there aren't significant changes to their work. For those who are forward-facing, requirements of N95s and other precautions are being warranted.
Yeah, our approach is pretty similar. We're fortunate that over 99% of people are vaccinated. There's a small number who require accommodations. I think our feeling was we have so many heavily immunocompromised patients, many of whom can't even have flowers in their rooms because the flowers can pose an infectious risk, that it's hard to imagine, having an unvaccinated staff member directly care for these folks. So for that reason, we've really restricted any direct patient care. It has to be outside of working with any population that has significant medical comorbidities or immunocompromise. And in most settings, it's very, very hard to strike an accommodation that meets all of those requirements. So I would say the people who are providing direct care are all vaccinated.
And there's another question that, were there cases where hospital staffers were granted exemptions, but no accommodations were available? Yes, for sure. Around the state, there were people who were exempted, but they could not be accommodated. There's a question about, can we translate the percentage of health workers who left over the mandate into the actual number of employees? It is from the reports, so I'll say that the survey that we have, not every hospital has responded. So I should have actually clarified that when I gave the data about 94%. From those who have responded, it's about 2,000 staff have left. And I suspect it's a bit more than that since we are missing some hospitals. My guess would be maybe in the 3,000 range as we're continuing to survey, but across this, we felt like we had good enough data to share the percentage of staff vaccinated. That looked pretty solid, about 94% across the state, but the actual number of humans who were that were lost, I don't know that we have that final number. Sorry for the not totally clear answer. I think that's all the questions we have received. Anybody else have a question either in the chat or want to raise it? Okay, I think and Ryan, does it look to you like I got through all the questions in the chat? I think I did.
It does, yes.
Okay, great. All right, so I think that we are planning, Beth, are we doing this again in 2 weeks? Is that correct? Is that our plan?
That is our plan.
Okay, so we're planning to do this in 2 weeks. We continue to have the goal that there's not enough to talk about in COVID that we don't need to do a media briefing. That would be that's our dream scenario. We are, as we said, worried about what we see in the northeastern states. So hope that Washingtonians will keep doing what they need to do, wearing their masks and keeping their distance and getting their vaccines. And I think really to emphasize Dr. Cohen's point, which I thought was an excellent one, we spent a decent amount of time talking about boosters, and they are important, but the most important is for the unvaccinated to move into the vaccinated. As we said at the beginning, we continue to have 10 to 15 people dying every day in hospitals, and that is remarkable. That is a remarkable number of people in our state, our fellow Washingtonians who are dying every day, and almost all of them preventable. And what a just incredible tragedy for them and for their families and those who love them. So very much encourage people to do all they can to protect themselves and not leave a wake of grief behind. Thanks very much. Take care.
Thank you.